with minimum level of SSE certificate about the cost implication of the whole process. Your dependents will also be able to enjoy. If this video interests you, please continue watching and stick to this channel. Hello everyone, my name is Blessing. Welcome back to my YouTube channel. I'm a nurse. I live and work in the United Kingdom. On this channel, I share vital information about nursing, beauty, lifestyle, family lifestyle, DIYs, and life hack. If this is something that interests you, please stick to this channel and keep on watching. In today's video, I'll be talking you through the process of becoming a healthcare assistant in the United Kingdom with minimum level of education of SSE certificate. Also, I'll be talking to you about who is a healthcare assistant. I'll also be talking to you about the process of becoming a healthcare assistant in the UK, talking to you about the criteria of becoming a healthcare assistant, and as well as the eligibility. I'll be putting you through the process and documentation of becoming a healthcare assistant in the United Kingdom. Also, I'll be telling you about the cost implication of the whole process of becoming a healthcare assistant in the United Kingdom. In addition, I'll be telling you about how long the whole process will take to become a healthcare assistant in the United Kingdom. I'll also be including how do I apply, that is the visa application itself. How do I go about it? Mind you, you do not need anybody to do this process with you. You can as well do this process by yourself. You don't need to pay any agent, because there are some agents that are ready to extort you, especially once they notice that you are eager and desperate to go through this visa process. I'll also be telling you about the benefits of having this visa application, that is, who are also going to be enjoying this benefit with you. This is not just for yourself alone. Your dependents will also be able to enjoy it. If you have a wife or children, you will also be able to bring them in to the UK on this type of visa route. Furthermore, I'll be including the care homes that are actively recruiting healthcare assistants from different parts of the country. Either you're from Nigeria, you're from Ghana, Zimbabwe, any part of the country, you are all eligible. This type of visa route is not majorly for people that are from European countries. So if you are interested in this visa route and you want to know more about it, continue watching. You need to know who is a healthcare assistant. A healthcare assistant is a healthcare worker who provides care for people in their homes or hospital settings or residential homes, who are unable to do some of the activities of daily living unaided. So this goes by asking, what are activities of daily living? Activities of daily living, they are just the normal thing we are able to do by ourselves. Take for example, I'm able to brush my teeth, I'm able to wash myself, I'm able to wear my clothes, I'm able to eat by myself. However, there are some elderly or children that are vulnerable, that are unable to do these things by themselves, these activities of daily living by themselves. That is where your own role comes in. So what is the role of a healthcare assistant? The role of a healthcare assistant is to support healthcare professionals like nurses, doctors, dentists, physiotherapists, and all. So you are only supporting them by helping your patient, caring for your patient, showing compassion for your patient, be a good communicator, and many more. So what is this healthcare assistant pathway visa all about? The pathway visa is actually simple. Like I said in the beginning of this video, you don't have to be a healthcare worker. This is open to as many people that are interested as possible. In as much you have a secondary school living certificate, that is SSCE, you are eligible. And you can also prove that you have been working in a healthcare setting for a minimum of 1 year. So you can go and do some voluntary job, and you start now. So if you're able to do some voluntary job or even go for trainings, these trainings will help you develop your skills, and you'll be able to be productive whenever you are joining the team. The main reason the United Kingdom government actually opened this way to people to come in to join the system is because they needed people to fill the shortage occupational list, and healthcare assistant is also among the shortage occupational list in the United Kingdom. So it is open to either you are a nurse from your home country, or you are a dentist, or you are a physiotherapist, a microbiologist, or even a community health extension workers that we all know as CHU. You are also eligible. Even if you have a secondary school leaving certificate, you are also eligible, in as much you can prove it with your skills that you have, and you have done some trainings that prove that you have been working in a healthcare setting for a minimum of so 1 year. This takes me to the question, how can you be eligible? You can be eligible if you have a minimum education of secondary school leaving certificate. I have said that earlier. Or if you have a diploma or a degree in health related courses, like maybe physiotherapy, dentistry, all this, or even veterinary, you are eligible. So after you've known that and you have established that, then you can start processing your documentation. The documentation is not something that it's too much for you to get, especially for those that are in the healthcare settings. If you are already in a healthcare setting, all you need to do is to have a valid passport, and also you have English language test, that is IELTS. You can prove your language proficiency by sitting for English language test with a minimum band of 4.5 in the 4 modules, that is reading, speaking, listening, and writing. It's that easy. Anybody can do this English language test and pass at the rate of band 4.5. It's very, very easy. It's not something you cannot do. Believe in yourself that you can do it. If you have a degree or a diploma in healthcare related courses and you think you can apply for ECTIS, then you can use that as your proof of English proficiency. So you can apply for ECTIS. ECTIS is formerly known as NARIC. So you can apply in the United Kingdom for ECTIS. So this proof of English can also be used for your visa. Also, you will need a tuberculosis test, because if your home country is one of tuberculosis endemic country, you will need a tuberculosis test, because you are coming here to work with vulnerable adults and you'll be working for more than 6 months. So it is one of the rules that if you'll be staying over 6 months in the United Kingdom, you have to be certified that you don't have a tuberculosis in your system. So you will be needing that. You will also be needing a police clearance. So this is just to clear you of any criminal conviction, just to be sure that you have not committed any offense in your country, and because you are coming here to work with some vulnerable adults, you need to clear yourself with a police clearance in your home country. Also, if you are married and you have children, you will need your marriage certificate. So your marriage certificate will be attached to all other documents. Also, you will be needing a COS by your employer. So this COS has a unique number. It also has the amount that you'll be taking annually. It also comprises of your job description, your contracted hours, as well as the areas that you'll be working. So the settings can either be a care home, a nursing home, a hospital, or a home care. So whichever setting you already know. But before then, you will have to tailor your CV into healthcare jobs. So say for example, you have done some trainings relating to healthcare, you will have to put it in your CV. If you have cared for your grandparents, if you have cared for your niece or your nephew, you also have to put that in your CV. If you have been able to tailor your CV to healthcare related jobs, then you can start applying to different care home, hospital, nursing home that are recruiting. I'll be putting down the names and the links of care home that are actively recruiting from different parts of the country into the United Kingdom. I'll be putting their names and their link in the description box, so you can feel free to click on it, send your CV and application, and I hope you'll be successful. So after you have started applying and all, then if any of these employers that are recruiting get back to you, then you can start preparing for your interview. So you have to show some compassion, care, commitment, communication during your interview. So if you want me to make a video about some of the interview questions that are usually asked for healthcare assistants coming to work in the United Kingdom, please put it in the comment section, and then I'll make the video. After you have been able to get a COS and all the necessary documentation, then you will apply for your visa. The visa itself just usually takes about 3 weeks, because it's usually a fast track visa, because it is a health and care visa. So I'm telling you, all this process with your commitment will only take about 6 to 8 months, and you'll be here in the UK practicing as healthcare assistant. If you're able to get an employer and they have issued the COS for you, then congratulations. Some employers usually refund tuberculosis tests, they pay for your IELTS, they pay for your visa, they pay for your flight, but not all employers. So that is where the cost implication comes in. So you have to be able to save up about 2,000 to 2,500. This will cater for all your expenses, including your tuberculosis test, your police clearance, your visa application, your flight ticket, and all other expenses that you'll be needing to come to the UK. If you have a family and you are coming to the UK, it is advisable for you to come alone first. You don't have to come with your family at once, because you don't know where you are going to stay, you don't know the environment. So you have to be the first person to come, at least to familiarize yourself to the environment, know the people around you, know how to board bus, know a lot of things before you can bring your family in. Some people might feel, oh, I really want us to move together, but my piece of advice is, you can move together, but it might be a little bit rough at the beginning, and you can face a lot of challenges. So I will advise you not to bring all your family members together whenever you are coming to the UK. So you can come first, and then after a few months, then that you have settled down, you've been able to get an accommodation, and you started working and you started earning some money, then you can now bring your family in. That is the enjoyable part. So I've come to the end of the video. If this video has been helpful for you and is interesting, please leave a comment in the comment section, and then I'll be responding to your comment. If you want me to make any video to clarify anything else that you, or any question that you have, also leave the question in the comment section, and I'll be getting back to you, and I will find time to make this video to you. If this video has been helpful, please give it a thumbs up, share this video to as many people as you can, and subscribe to my channel, and I'll see you in my next video. Thank you so much for watching. Bye.